Hi, Dr. Willow here. With 2026 being a big year for patient goals, I want to circle back on one of the biggest ones for people, fewer headaches. When you start care here, I oftentimes describe headaches like a waiter holding a serving tray, where there's lots of different things that can cause a headache. We have poor sleep, diet, salt intake, stress. Any one of those kind of stress and inflammation things can cause a headache. But when we add in that the first two bones in the neck, if they aren't moving quite as well as they need to be and causing irritation in that area, that's the thing that can topple that tray and ignite a headache. So we can't oftentimes take away every single thing that can cause a headache, but we can take away that ignition source. So that's the same situation with both headaches and migraines. Recently, we had a patient that she started developing new migraines and at a frequency that was concerning. It's something that she's had migraines in the past, but they were increasing in frequency. We ended up taking a new set of x-rays, and on the motion study, we were able to see that very specifically, every single bone in the neck was moving to the quantity that it needed to, except for the first bone. And from that, we guided a specific care plan in the way that we adjusted her neck because there was some ligament laxity lower on that we had to do some protective maneuvers that before we were doing only instrument adjusting, and we transferred over to a really methodical kind of manual adjustment to make sure that we were isolating motion just at that first bone. Pretty dramatic pop happened, and lo and behold went from 5 migraines a week to none. And so that's the kind of result that you can't make up, and it's also proof in the concept that when the first two bones aren't moving enough, oftentimes that can take away that ignition source.